It's from Raglan Maddox. And please, Raglan, can you tell me if I've given you the wrong title, but are you the Study Director of Tackling Indigenous Smoking at the ANU?
Yeah. Yeah,
Cool.
that's correct. Thanks.
Thanks, Ben.
And thanks, Tom, for the presentation. Very interesting, and probably some things that we'll touch upon as well. I'd also like to begin by acknowledging the land on which I am, the Ngunnawal and the Ngambri people, elders past, present, and emerging. And it's great to see, I know, Tom, you mentioned that it's good to see so many new faces, which is really exciting, but also I was quite thrilled to see a lot of familiar faces. I think Denise and Nathan and Paula probably around in 2010, so it's great to see. And as you mentioned, we've seen some exciting. I guess I'm going to speak a little bit about of the evaluation. I might need to rename the Part B part. It sounds a little bit second rate, but we might come at that from a strength-based approach at some point. Next slide. Thanks, Ben. I assume people can hear me as well. Yeah, cool. I'm seeing nodding, so that's an encouraging sign. Maybe not Ben. And yeah, so I was going to introduce myself. So I actually come from the Modowa clan in Papua New Guinea. And so I, like Tom, am disappointed that I couldn't get up to Darwin because I'm a tropical boy and being stuck in Canberra for the winter is probably not ideal. And so come from Milne Bay, so the southeast tip of Papua New Guinea, just across the across the Torres Strait there. And then I've got a photo of my my mother is the one in blue where the mouse is, and then my uncle is also in that photo when they were at boarding school. And below that, I guess, is where my people are from and where my sister semi-recently renewed her vows. But I'll generally use this as a bit of a tourism brochure to go and do some good fishing and crabbing and whatnot. And I guess I ended up in Canberra through the Papua New Guinean independence movement, and then so have lots of family both in Papua New Guinea and predominantly throughout Queensland. So I'm not sure why I chased the cold weather on frosty mornings that we're having at the moment. Next slide, please, Ben. And so, yeah, I guess I'm looking forward to hopefully when COVID wraps up. I guess this year we were hoping to go out and do lots of site visits, which obviously we're trying to redo the way we're working, just like everybody else. And I'll sort of explain a little bit about that as we go. As Maxine mentioned, I'm currently working at the Australian National University in the Aboriginal and Torres Strait Islander Health Program on the Tackling Indigenous Smoking Impact Evaluation. But there are a whole range of people involved in that process, including Professor David Thomas, who's also on the call today and presenting later. We also have a team at Australian National University that are looking at a whole range of different administrative, I guess, data sets, which look at different components of smoking, and I'll talk to that throughout this present over time, and sort of looking at the impact of the program. So we're looking at trends, I guess, before 2010 and then throughout that process. And we're working together, obviously, with the practice unit, Quit Victoria, and then also Circa, which Tom mentioned earlier. Next slide, please, Tom. Ben, even. And one of the reasons we're looking at administrative data sets is also because that data has already been collected and we're trying to minimise the burden of research on our communities. Maybe my internet is slow. But anyway, so next slide if you get a chance, Ben. Either that or I'm very quick. Might have had too much coffee already. So this is a photo of the team.
Can I just ask if you can turn your video off? It might help with their internet connection.
Yeah. Perfect. Thanks, Ben. Do you want to get back a slide, if that's all right? I think we might have skipped one. Or I can start from here anyway. So the evaluation governance, so we have Tithu Thame, which is our Aboriginal and Torres Strait Islander advisory group. We have the partners that I just mentioned, and we're funded by the Department of Health. This is a photo of the Aboriginal and Torres Strait Islander Health Program team. And basically we want to answer what's working to improve health and wellbeing of Aboriginal and Torres Strait Islander people. We have predominantly Aboriginal and Torres Strait Islander staff and students. And this is a photo taken last year, so there's probably a few familiar faces in there for some of you, and we've probably recruited relatively heavily from Woononga, the local Aboriginal medical service in Canberra, so there's a few people that have been involved in the Tackling Indigenous Smoking team over time. We have Indigenous leadership and governance, including active involvement in Indigenous data sovereignty movements, including data sovereignty in relation to the evaluation. We use community-driven approaches to, I guess, try and provide more context to the quantitative data that we analyse, and analysis and approaches, and also we take generally mixed methods approaches, even though we are an epidemiology centre. So I guess that's one of the things that we're progressing or trying to challenge within the academy. Next slide, please, Ben. So Tithu Thame, which is our advisory group in our data governance group. Some of you might be familiar with the Mayi Kuwayu study, which is a longitudinal study of Aboriginal and Torres Strait Islander wellbeing. Has this governance arrangements, which is Tithu Thame, and it sort of means to share knowledge. And that's sort of, I guess, the core of our program. And we've had over 10,000 participants complete that survey, and I'll speak a little bit about that study in a second. The program executive is listed on the right-hand side, so Ray Lovett, Jill Guthrie, David Thomas, Katie Thurber and myself. And then we also have a number, as I mentioned before, of evaluation team members from the previous photo, including two Masters of Applied Epidemiology students, one which is actually based in Darwin. So Margaret, Nikki, they're looking at various aspects of tobacco use, and I'll mention that in a second. Next slide, please. So I mentioned what we're trying to explore, and that we're looking at a number of data sets to try and answer these questions and provide a sort of a more comprehensive understanding of tobacco use and tobacco-related outcomes, and if they've improved faster in areas with Tackling Indigenous Smoking funding compared to those without Tackling Indigenous Smoking funding. So some of the information we're looking at is obviously the prevalence of tobacco use, looking at people who have quit and stayed quit, looking at behaviours relating to quitting. So if people have been referred to the quit line or called a quit line, things around pharmaceuticals, so stop smoking medications, including NRT and access to NRT, smoking initiation. So we have seen delays in smoking initiation over time, and people not taking up quite so young. We've seen reductions in secondhand smoke exposure and increases in smoke-free homes, smoke-free policies. As Tom mentioned before, smoking in pregnancy is a priority, or not smoking in pregnancy is a priority, so that's another aspect we're looking at. And then attitudes about smoking and quitting, as well as smoking status being recorded. And I guess together we're trying to understand what impact the Tackling Indigenous Smoking teams have had, because we appreciate that smoking prevalence can be quite a blunt indicator, and we know that change occurring is not just about prevalence, but also a range of other impacts that are happening in communities. Next slide, please. So why do we need to do this? I think Tom sort of spoke to this before on the importance of this policy. It has been going for about 10 years now. And so it's important to understand the evidence and have information to not only evaluate the program, but I guess to help inform what activities we should be focusing on moving forward. And maybe what types of activities have been more or less successful in communities, so that we can really highlight those strengths. So if you have evidence that the Tackling Indigenous Smoking teams are helping improved smoking related outcomes, this can be used to support TIS expansion. For example, as Tom mentioned, there has been expansion in a couple of additional regions recently, and also are not contributing to improvements. Then we can try and understand what isn't working and how we can address or strengthen those areas of improvement. Next slide, please. So what are we doing? And again, I sort of reiterate that obviously with COVID, there's been some significant changes to the way that we've worked. And so instead of spending this first year out in communities trying to define boundaries, which I've spent a fair bit of time in the office and not out and about, which is a bit disappointing. And so that means that we will be mapping. We've developed a tool to help map some of the TIS boundaries, but also understand what programs and policies are being implemented across the country in terms of the reach, the intensity, the types of activities that have been going on. And I'll speak to you a little bit about that in the next slide. We're also analysing, as I mentioned, existing data sets. So data has already been collected from population levels. Sorry, Ben, I was just saying, yeah, thanks. We're going to analyse a number of data sets, including ABS data, the Australian Institute of Health and Welfare collect data, including data around smoking and pregnancy. The Pharmaceutical Benefit Scheme obviously collects information about medicines to help people stop smoking. And I'll sort of go into those or give an outline of those data sets shortly. And then at the end, we'll bring all those findings together to have a sort of a picture of Australia and what's been working particularly well and what areas we can improve on. And there'll be evaluation reports, publications and community feedback. So hopefully this will be, if you haven't heard from me already, this will be one of our first steps in that sort of ongoing engagement process and trying to make sure that the information we're looking at and analysing is as useful as possible for you and the community, as well as looking at that from a national level. So next slide, please. So while it looks relatively linear, it is a sort of relatively circular process. In relation to that first step, and I mentioned sort of spending time in community, which unfortunately we started doing but didn't get to the NT before COVID came through and threw everyone off. We have sort of commenced doing some defining of boundaries. And so on the left-hand side there, I just have a couple of maps to highlight, I guess, the change. So the first map is Horton's language map, which sort of, I guess, shows the diversity of Aboriginal and Torres Strait Islander people across many nations, and which is now called Australia. And then we have, I guess in 2010, we have the regions for the Tackling Indigenous Smoking program. And then more recently, we have sort of a preliminary draft of the Tackling Indigenous Smoking map. And then on the right-hand side, we have sort of an online tool that we're currently piloting, which we'll send to each of you and hopefully have a meeting to discuss what sort of data we're going to analyse and come up with an intensity score. So looking at what sort of activities, how many activities you're undertaking in terms of, are we focusing on youth and young people or pregnancy or the whole population or men or whatever that might be, so that we can help to manage expectations around what sort of changes we would expect. And that sort of comes back to the data sets that I mentioned we'll be looking at So not just prevalence, but a whole range of indicators to provide that comprehensive picture. Next slide, please, Ben. I won't go into this slide too much because I think Tom already showed this slide. But this is just comparing urban and regional Aboriginal smoking prevalence and then remotish Aboriginal smoking prevalence. And you can see that those changes are quite different. And this is mapping from 94 to 2014-15. But I guess if we think about the language map and other things, there is actually great diversity there. So one of our roles is to try and understand the nuance within that smoking story and the narrative that is going out. So next slide, please. Which is one of the reasons why we want to understand the intensity score. There's also a link later in the presentation for a review we've undertaken recently. And in the review, there is also this figure. And I guess this is starting to unpack some of the story around smoking prevalence. So while we know it's been relatively stable, I guess, in remote areas, there have been changes. And when we start to unpack what those changes look like over time, then we can help inform our programs and who we want to target or who we want to work with in that sort of situation. So the top of that panel figure, we have smoking prevalence from 2004 till 2018-19, the latest ABS data, and we've got it by sex. So you can see females and males, females being sort of the orange colour, slightly lower smoking prevalence than males, but again, a consistent decline over time. And you can see that that's obviously reflective of a lot of the great work that everyone in this room, everyone in this Zoom meeting is undertaking. When you look at urban and regional areas, you can see significant declines across almost all populations between 2004-5 and 2018-19. Although the older population shows a slightly different story for those aged 55 and older. And part of that might be around people living longer and different access to care. And then again, if we start to look at the remote figures and break that down by age group, we can see there is some nuance to that story that might not have been captured in the previous slide that sort of showed a stagnant relationship. So you can see that prevalence among 45 and up and 55 and up has a slightly different story or trend in comparison to those 44 and below. And there's a whole range of hypotheses for this, but one hypothesis could be that some smokers are living longer. So these are some of the sort of questions and things that we would like to explore so that we have a better understanding and can help inform smoking programs and policies in the community. Next slide, please. In saying all that, so over the last decade, so when we look from 2004-5, if smoking rates had stayed the same, then we would have seen almost 50,000 fewer daily smokers, more than 23,000 lives saved, and overall a 9.8% reduction in tobacco prevalence in daily smokers. So there is some very good news going out, but there is more work to be done. Next slide, please. And part of our role is to try and explore that by analysing existing data sets, including the ABS data sets that I mentioned before, and just sort of showed you some snippets. National perinatal data sets, health service data, PBS data, and also quitline data. And Tom mentioned the Aboriginal quitline earlier. Next slide, please. And I guess part of the job when we go and speak to each of you and do the mapping exercises to try and understand if there are particular data sets you're interested in and how we can return some of this data that's already been collected back to the TIS teams and back to communities in a useful way. One way we're looking at sort of hypothesising is if we were looking at smoking during pregnancy, and that's where the perinatal data set would come in, is looking at TIS regions and non-TIS regions. And as you can see on the slide, that we would expect a steeper decline and smoking during pregnancy among TIS regions. Again, we could sort of hypothesize a whole range of things based on where we focus our efforts around promoting smoke-free environments and smoke-free norms. Next slide, please. And we're happy to go through and talk to each of you individually about those and what you would find of interest. And we're also analysing new data. So the Mayi Kuwayu data set that I mentioned, and I think I saw someone post a link in the chat. Yeah, so thanks for that, Ben. The Zoom admin posted a link to the MK study in the chat. So I'd encourage anyone who hasn't completed to complete that. And one of the things that it's looking at is around smoking behaviours. And I know a number of you have already started using that survey and have been sites for that survey to capture a whole range of information, including smoking behaviour, but it also captures a lot of information about culture and strength-based approaches, strength-based indicators. The study's Aboriginal-led and governed, and it also looks at participation in tobacco control programs. So I think Deadly Choices is one of the programs it includes. And also can look at, one of the things that is quite unique about it is it can look at culture, trauma and racism and the relationship with tobacco use, which we can't necessarily look at in some of the other data sets that we're looking at. So the ABS and other places don't necessarily capture the same information. Next slide, please. And I guess the flip side of that, and if we are looking at it from a strength-based approach, is looking at how preventing trauma and creating safe and supportive environments can prevent tobacco use or promote smoke-free behaviours. And on the right-hand side of that slide, there are some lovely photos from the data collection process. As I mentioned earlier, there's lots of capacity building built throughout the evaluation, learning from service providers, partners and communities, increased investment in tobacco control, Indigenous tobacco control. As I mentioned, we already have 2 Masters of Epidemiology students. We have a number of medical students working on tobacco use or tobacco reduction, and then also looking at disseminating research findings and materials, including research policy and community formats. And then the Mayi Kuwayu study also includes some work where we're returning to sites to do 2-day workshops in data analysis, so that we encourage communities to analyse their own data or ask questions about their own data and sort of build capacity that way, as well as within obviously universities where we're trying to create safer spaces for Indigenous people. Next slide, please. One of the pieces of work that we also published recently, and David was also an author on this, is a review of tobacco use among Aboriginal and Torres Strait Islander people. Thanks for the 5-minute warning, I'm not too far away. And I'd encourage you to have a look. There's also a summary and fact sheet and a video and some knowledge translation products that Edith Cowan University have developed. And I think this can be quite a useful document and sort of looks at pre-colonial tobacco use and looks at colonisation and then I guess the causes of tobacco use. So starting to understand that. Next slide, please. I'll look at that and then probably got 4 minutes for any questions, but hopefully that made sense, although it's a bit strange just talking to blank screens.
Okay,